Welcome to India Next. Today we are with Dr. Chandrakanth Agarwal. He is a crusador against thalassemia. Thalassemia is a genetic disorder that occurs in the body. As a result, the body stops producing required protein, hemoglobin, which carries oxygen with red blood cells. Dr. Chandrakanth, who believes in helping mankind, is the meaning of our life, has established Thalassemia Sickle Cell Society to eradicate this disease completely. In 2022, he conducted 2,50,000 blood transfusions and was National Award at the Medical Conference Noida. Telangana government also honored him with a state award for his relentless fight against thalassemia. Let's talk to Dr. Chandrakanth and know about him and his noble mission. Good morning, Dr. Chandrakanth.
Good morning. Yes.
So, first of all, just a normal introduction I want from you that this thalassemia, as a common man, we know it's not curable. So, just introduction about that disease and its curable, the percentage, how much it's curable and all. You just give an overview.
Thalassemia is definitely curable. Bone marrow transplant is the only treatment at present available for thalassemia. But we require for bone marrow transplant the siblings or the parents with HLA 100% match. Then only it is possible. Recently, one more study has come, haplotransplant, which even if the 100% match is not with the sibling or parents, it can be done, and we are successfully doing this also. Let me tell you something about thalassemia. Thalassemia is easily preventable genetic blood disorder. That means it comes from the parents to the child. If both the parents are thalassemia minor, then only there is chance of giving birth to a thalassemia major child. But not every pregnancy is thalassemia major. 1 in 4 approximately are thalassemia major children born to the carrier parents. That is.
Okay, sir. So, this is, the procedure, what's a curable, what's the timing of this procedure? How much time it will take to cure a child?
No, basically it can be cured as soon as the child is about 2 years age. It is fit for BMT. But there are many parameters manage the child for bone marrow transplant. His liver should be okay, spleen should be okay, ferritin levels should be okay. All parameters, if they are normal, the child at the age of 2 years is also fit for bone marrow transplant, and up to 12 years, they are really good cases for bone marrow transplant. Even if they have crossed the age, the risk of course increases as the age increases. Recently, about 6 months back, we got transplanted for our patient. She was 24 years old, but she was well managed. Got done transplant, though it was a bit risky, but it was 100% successful, and we are happy that she is doing well.
Okay, sir. Sir, I want to know that what made you take up this unique cause of saving people from thalassemia?
My own granddaughter, who is 25 years now, she is thalassemia major.
Okay.
Yes, and been to Italy for her bone marrow transplant. Those days, haplotransplant was not available in India, but she rejected. That means back to thalassemia. That actually brought me to this cause, and I decided on that day that I should serve for thalassemia, because I have seen the pain of thalassemia parents from very near. How they suffer, the blood is not available, the diagnosis is not available, doctors don't know about the medicines, what medicine should be given, how to manage the children. That was a big challenge. I joined this society, which was already running. It was established in 1998, though I was attached, but not totally attached. After coming from Italy in 2011, I totally attached here. Seeing my attachment and my anxiety, I was made president in 2012. From then, the society is growing like anything.
Sir, It's really inspiring. But the thing, as a parents, you feel the pain. That's why.
Yes. And let me tell you, this society is run by the parents only. All the board members are parents of thalassemia children only. That's why they see the pain. They know the pain of thalassemia. The blood is not available, medicine is not available, awareness is not available, counseling is not available. They don't know. As of now, I can tell you, we are the biggest society in the world. In the world, it is 4,240 children we are serving. We have patients coming regularly from Tripura, Assam. I tell them, why do you come such a long distance? Kolkata is a very big city on the way when you are coming this place. I will speak to Apurva Ghosh, one of the social worker there, doing service for thalassemia children and blood donation. But they say, no, the treatment what see here, the counseling, the treatment, the homely atmosphere we get here, we can never get anywhere. We don't charge anything to the patients. It is totally free of cost.
The whole treatment is free of cost.
Totally free of cost. Blood transfusion, medicines, test, investigations, HLA typing, bone marrow transplant. Everything free of cost.
So it's very, and I want to know, sir, what is the situation you found at the time of taking up this as a moment? The situation when you are just...
When I joined here, I very well remember we didn't have funds for paying to our staff at that time when I joined. 2-3 months balances were there and we were struggling for blood. Even blood was not easily available. Our children were suffering badly for blood and medicines. Medicines were absolutely not available. When I joined, slowly the funds also came. I just called my friends, Arvai, send a lakh rupees, 50,000 rupees, like that. The funds were available immediately. So we were in good position. One fine morning, a gentleman came to our society. He was just giving donations, 50,000, 2,000, 5,000 to orphanages, medical institutions and educational institutions like that. He entered our society. He literally started weeping. What service you are doing? I can't believe. He gave us 1 crore rupees on hand. Vasudha Foundation. That is, they are in pharmacy. That's why after that we didn't look back for funds, and we are serving to the best of our capacity to the for the thalassemia children, and every account, everything is transparent here.
Okay, sir. And how did you find government's concern as far as the important healthcare issue?
No, basically government is supporting us only under Arogyashri as they support to other diseases, but they are not at all bothered about thalassemia prevention. We have been giving our representations to the health minister, chief minister also for prevention. Basically the cost of prevention is not even 10% to the cost of treatment. But still they are happy with the treatment expenditure, but not for, because it is not in their protocol. They have many other important political agendas and they are not at all bothered. But they are supporting for the treatment, which is, we don't want that. We don't want that. Basically, when it is preventable, why do you want to go for treatment?
Prevention is better than cure.
Prevention is better than cure, yes.
What are the activities you have been taking up towards creating awareness and eradicating the disease completely?
Yes. Our team goes to colleges, colonies, MNCs. They give talk about awareness. What is thalassemia? How to prevent thalassemia? What are the measures to prevent thalassemia? Like that, every time and in all the blood donation camps, every day we have almost a blood donation camp with us, because we require 100 units of blood daily. So it's not easily available. So in every blood donation camp also, we give any of our representatives give talk about prevention. And about prevention, we have met collector of Mahbub Nagar, who, because government of Telangana was not supporting, we met the collector directly, who was a friend rather. We requested him that we can start a project in your district at least, if you permit. So he called his team of doctors, and our team of doctors went there and gave presentation what project we want to do. The project was approved. Basically, what we are doing there, with the permission of the collector, we are going to every primary health center of Mahbub Nagar, and with the help of ASHA workers and Anganwadi workers, we are reaching every pregnant lady in first trimester of pregnancy and taking sample. If she is carrier, then we counsel them. If she is not carrier, she is permitted to continue. And carrier means, again, the husband is tested. If husband is also carrier, then we bring them to the center. See, you may give birth to a thalassemia major child. All these parents, all these patients never knew what is thalassemia. Even you don't know.
Yes.
So you can definitely prevent this. How can we prevent? They ask. The fetus has to be tested. If fetus is thalassemia major, you have to go for MTP, that is abortion. If it is not thalassemia major, you can continue the pregnancy. Why do you want to leave the child who is thalassemia major for the whole life? You have to.
Then they also have to face a big challenge to counsel them.
Which can be prevented. They don't agree. Then after the test, if it is thalassemia major, they are definitely counseled rigorously, and then like that we got about 84 MTBs, that is abortions gotten, saved thalassemia major children taking birth.
Because generally in our country, people are not, first of all, it's tough to make them to do test.
Yes, yes.
This is a big challenge. And
No, let me tell you, when ladies tested, she is the thalassemia minor, that is carrier. When we go for testing for the husband, he doesn't agree. Mera test kai ko bhai? Why you want to test mine? She is pregnant. She is the if both are carrier, then only the child can be thalassemia major. No? Then we have to counsel them, prepare them. Then they agree. Just for example, that too we are doing free of cost.
but till they have, it's very tough to make them understand.
Yes, yes. And as of today, I can assure Mahbub Nagar district is totally thalassemia free. Not even a single child with thalassemia can take birth in Mahbub Nagar district. That much we have reached. That project we have presented to Telangana government also. When a small person can eradicate thalassemia from Mahbub Nagar, why can't you do such a big machinery you are having? But it's not going on.
Yeah.
Because they have to just pass a GO saying that all the pregnant lady in first trimester of pregnancy should be tested for HbA2 test. This has to be given to all the gynecologists and hospitals. That will be done easily. It is 100 rupees test. But every pregnant lady is tested for thousands of rupees. Ultrasound kara kya ho, HIV kara kya ho, blood test kara ho, ye blood test. But they don't prescribe for 100 rupees test.
Generally package में रहता ही नहीं.
रहता ही नहीं है. Protocol में ही नहीं है उनके. Yes.
Exactly.
We want to introduce it. If it is there, they will automatically do it.
How do you find the infrastructure and necessary arrangements to ensure blood transfusion to needy patients and save from thalassemia?
See, we have a well-equipped blood bank. We have been awarded twice by state government and South India government for best blood any NGO is having. So that means we have best quality of blood available with us, best of staff is there, and the blood is after testing and matching with the patient is safe blood is given to the patient whenever they come. And we have trained nurses here. We have about 60 beds available. Every time all the beds are full. And the patients have to register them for transfusion, though we give the dates, that you have to come on that day, because when they come after 20 days, as per their hemoglobin level, we ask them to come after 15 days, 20 days, because that blood should be supporting them for those many days, and doctors decide that. And that day they come again for blood transfusion. That is a regular process. Every lifelong they have to come. We have children coming 3-4 years of age. They come for cannula. Just put cannula like that. They will come like that. They don't weep. If the vein is not found, if vein is not found, they are ready for the second hand. Like that. That means they come here as a picnic, not for to the hospital, because they know after this transfusion they'll be totally full of energy.
Okay, sir. Are you planning any special awareness campaign and health camps in the process of preventing vulnerability and eradicating thalassemia?
Yeah, it is already every time it is going on. Every blood donation camp it is given. Our team goes to, as I told you, to colonies, colleges, and MNCs. Wherever we find any opportunity, our team goes there, give talks about prevention, whatever questions they have, because many of them don't know what is thalassemia. They have never heard thalassemia, and I'm sorry to say, many doctors don't know about thalassemia. Doctors. About treatment is a very different matter. They have not heard thalassemia. That is and gynecologists can be really very much helpful for eradication of thalassemia.
Do you have any plan to involve NGOs in taking up your society activities?
Yes, we have invited 3 times. We have all the societies in India to our center for one-to-one discussions. What you are doing in your area, that MP, Madhya Pradesh, what are you doing? Jammu Kashmir, what are you doing? Tamil Nadu, what are you doing? What we are doing? What we are missing? What should be? Like that discussions are there. But everybody has praised our center to be the best among all of them, and they have learned a lot. And after they visited, they have started giving talks and prevention activities, and many phones I get calls from them. Chandrakanth, isko kaisa karna hai, usko kaisa karna hai, how should we, like that. Anyway, all the societies are attached to us directly.
So, do you have any ambitious plans to take your mission to pan India and global?
Definitely, yes. This global team is coming to us on 24th. They are visiting my society on 24th to collaborate with us internationally, and maybe we will be the first in India to be having collaboration with them. And we expect that if what plans we are having about eradication, if the government gives that GO or bill, passes a bill in the parliament for testing of pregnant women in first trimester of pregnancy, this can be easily eradicated. And if the bill is passed, within 10 years, India can be thalassemia free country.
Sir, here I have a question. So, suppose a woman got a minor and her husband got major, and in first trimester you just abort the baby. What is the second chance?
Second, there can be a thalassemia major child or cannot be. Again, they have to go for testing. So it's not that every child will be thalassemia. Say, in my case only, my son had 3 children. One is thalassemia major, 2 are normal. We have many patients here. 5 children were normal. 6th was thalassemia major. Okay. That means every child is not thalassemia major, but any average 1 in 4 is thalassemia major.
So here I just want to know, okay, suppose to try someone got thalassemia major kid. So तीसरी बार try करने से पहले वो लोग डरेंगे.
Obviously.
तो in that case, अगर तीसरी बार वो लोग रख भी देते हैं कि okay, we don't want to abort again. तो वो child वो curable होगा?
Curable?
मतलब after I mean getting birth by birth if you got thalassemia major, तो वो तो उसके जन्म के बाद भी केयर हो सकता है ना?
हाँ, yes. Bone marrow transplant, the only treatment.
that's
Yes,
what I'm
yes.
saying.
Every child is curable.
So and the minima, I just want to know the timing. Suppose 2 years में किसी को identify हुआ कि हाँ he is thalassemia major. So how much time it will take to cure? Like from 2 years अगर
The total process is 1 year.
1 year process.
Yes.
Okay.
Though before bone marrow transplant, 3 months they have to undergo all the test, investigation, everything, and the process for chemotherapy is there. In that chemotherapy, 15-20 days they take, and after the bone marrow transplant is not a big surgery. It's just like giving blood transfusion only. The bone marrow is received from the donor and given to the patient. If the body accepts, it is successful. If it does not accept, it is rejected. Sometimes mortality is also there. But nowadays the medical is very much advanced, so the cases of mortality is very, very less.
Okay. And one thing I just want to know, this is thalassemia is blood, like red blood cells, that problem. And another disease I came to know about aplastic anemia. So what is the difference between thalassemia and aplastic anemia?
It is totally, in aplastic anemia, the person has to undergo the treatment or bone marrow transplant immediately, otherwise they will die. In case of thalassemia, they can survive with blood transfusion and chelating medicines lifelong. That means 45 years. We have seen a patient 68 years age with thalassemia major surviving totally fit, because they took blood transfusion every 15-20 days, chelating medicines regularly, getting tested all the organs of the body. If they are working good, they are living normal life.
Okay.
But aplastic anemia, they can't survive unless until they are given immediate surgery, bone marrow transplant, whatever the.
And one more message I just want to get for you, that when I was just before my marriage, I asked to my parents कि I don't want to go any kundali and all, but I want a blood test. It's very important.
Yes.
But now when I came to know, and me and my would-be were very much tension कि what will be our blood report will be.
Yes.
So if it's come negative, he asked me so many times, if it's come negative at something, then he will marry. Otherwise, if it's come positive, he will not. So this kind of tension is not only me, with my other friends, my fellow friends also facing the same issue. So what is your message to them for youngsters?
It is definitely a big problem basically, but trust me, even if both the partners are carriers, even then if they are very much eager, we want to marry, whatever it is, they can take opinion at the time of pregnancy. They can avoid. As I told you, at the time of pregnancy, they can get tested CVS sampling, and if the fetus is thalassemia major, they should abort. Take one more chance. Others also, if it is thalassemia major, they should get abort. Then one more chance. That means they can easily avoid a thalassemia major child.
Okay. And if by chance it's happened, then till you people are there to cure.
Yes. Definitely, yes.
Okay, sir. Very nice to talk to you, sir. I think now lots of people get idea about this and they will get precaution. And
again, my message to every family will be, they must compulsorily get tested HbA2 test before getting married. They must get, don't avoid it. And if the government comes out with the GO or the bill, that will be great for the humanity. Being thalassemia carrier is not a disease. It is not at all a disease. I am thalassemia carrier. I don't have any symptoms. I am totally normal. At the age of 74, I can do anything. Like this, there are 5 crore people in India are thalassemia minor. Among them, Amisha Patel is thalassemia minor. Amitabh Bachchan is thalassemia minor. They are absolutely normal. Minor is not a disease. If both the parents are, both the partners are thalassemia minor, then only there is chance of giving birth to a thalassemia major child. be aware, get tested. If you are a thalassemia minor, avoid marriage with thalassemia minor, even if it is both the parents are thalassemia minor. You can definitely avoid giving birth to a thalassemia major child by getting semen sampling at the time of pregnancy. Please.
Okay, sir. Thank you so much.
So that's all.